Lori Lee spends a lot of time trying to keep Connecticut's largest health system stocked with medical supplies from 4 lines to gauze bandages. It's a job that's gotten increasingly harder as unprecedented snarls have tied the supply chain in knots. There are probably hundreds of outages of items that we order that do not come in, says Lee, Senior Vice President of Clinical Operations at Yale New Haven Health, which has annual revenue of. She says the list of shortages includes basics such as floor tubing and catheters, which are used constantly in hospitals. With just-in-time ordering, the health system relies on distributors to deliver supplies quickly rather than hospitals keeping them in stock. Many of those things on a daily basis don't show up, Lee says. She's resorted to having her team of doctors and nurses search for substitutes, which requires training nurses in the slight differences in how they might operate. This is not really like Coke and Pepsi, Lee says. It's a massive effort every day that we're really struggling with. The U.S. healthcare system is facing supply shortages that dwarf the problems experienced in the early days of the COVID-19 pandemic, when needed personal protective equipment, like masks and gowns, was nearly impossible. Back then, shortages might have been more urgent, but today's problems include a much wider array of equipment. They can be traced to component scarcities, backlogged ports, transportation glitches and lockdowns in China to combat the spread of COVID-19. Much of the attention on the supply chain crisis has focused on automakers and electronics companies dealing with factory closures in manufacturing hubs such as Shenzhen and Shanghai, but the effects of hard-to-find supplies of medical devices and supplies are severe, too, and impact doctors' office. It includes latex and vinyl examination gloves, surgical gowns, laboratory reagents, specimen collection testing supplies, saline flesh syringes and dialysis-related products, according to the U.S. Food and Drug Administration. Owens & Minor, a healthcare logistics firm with $8.5 billion in annual revenue, says that 45% of the items it handles are in some way supply constrained,